Welcome to Houston, We Have a Doctor, the podcast that takes you behind the scenes with the physicians, surgeons, and healthcare leaders shaping our city. I'm your host, Dr. Sterling Carter, physical therapist, Army veteran, and the founder of the award-winning Sterling Physical Therapy and Wellness. Each week, we'll sit down with Houston's top docs to hear their stories behind the scrubs, how they're changing lives, innovating care, and keeping Houston strong. Let's get started. Hi, everyone, and welcome. My name is Dr. Sterling Carter. I am the owner of Sterling Physical Therapy and Wellness, and welcome to our Houston We Have a Doctor podcast. And what we'll do today and what we're going to do moving forward is learning a little bit more about our doctors right here in Houston. And more specifically, we're going to learn about our doctors of physical therapy that work right here at Sterling Physical Therapy and Wellness. So without further ado, I am honored to introduce each and every one of you to Dr. Krizia Martinez. Welcome, Dr. Martinez. How are you today?
Thank you so much for having me. I'm doing well. Thank you.
Great. Did I do a great job with rolling the R?
Yes, you did. You did.
I rolled the R. I love it. I love it. I love it. I'm super excited.
We're already starting off well.
So we're going to jump right into it, Dr. Martinez. So let's just start with you telling us about how did all this happen? How did you become a physical therapist? Tell us about your journey.
Yeah. So I graduated from Texas Tech University Health Sciences Center in Lubbock. Mm-hmm. And I can't even believe it. I graduated in May of 2019. Wow. And, that was amazing. I felt like God knew that he wanted me to be, have no distractions and be in the middle of nowhere. But it was an excellent school. It was exactly what I needed. Beautiful curriculum, professors. But I got into it, after it was always what I wanted to do. I knew early on during high school that I wanted to do something in healthcare. I didn't want to be a nurse. Okay. I actually got a full ride for my undergraduate degree to become a respiratory therapist. And my parents, they've always been very supportive, but also very honest. They said physical therapy is very competitive. So what's your plan B? And I was like, what do you mean? What is my plan B? So I actually practiced as a registered respiratory therapist for a few years. And I knew in my gut that when I was working in a hospital, extubating patients, working in the NICU, ICU, I would see a physical therapist walk in with their khakis and their polo. And I was like, God, why not me? Right. I think I'm a great student. I want to be molded. I was intimidated, but that's what I wanted. And so I made it happen.
That is so awesome. I'm just learning so much more about my therapist here. It's so great. Mm-hmm. So respiratory therapist.
Yeah. And it's actually, and UT Galveston, they have a bridge from RRT to DPT. So there's a lot of overlap with the, context that you get as a clinician who's skilled in the cardiopulmonary system. You have to, we also have to be responsible for the anatomy. So now as a physical therapist, first I used to see a patient come in as an acute stroke or, heart attack or what have you. And now I'm actually seeing them at the end versus the very beginning of their care.
Excellent. So that brings in the next question. So now that you're on the physical therapist side, mm-hmm. What would you say is the most rewarding part of being a physical therapist?
I know the relationships that I get to build, the people that I get to meet, and more importantly, the people that I get to heal. I feel at Texas Tech, when we had our white coat ceremony, they had us take an oath to mm-hmm. take care of patients. And for me, not only do I want to take care of them, but I truly feel passionate about healing people because I feel, there's so many patients that need healing. And in physical therapy, I think you can agree with this, is that when they come to our office to get evaluated, they are so happy with the time that we give them because it's very rare for them to see a clinician with a doctoral degree that gives them enough time to express themselves and actually get better.
Yes, so true, and that's a resounding message that I'm hearing with all of the interviews that I've had so far. Mm-hmm. Is that one of the special things about physical therapy is we do get a chance to have one-on-one time with our patients, and we're able to establish the great rapport with them, and we see them kind of work through the entire process. Whereas in other parts of healthcare, you only see your patient for maybe 5 minutes or 10 minutes. 15 minutes, and then you see him 6 months from that day, or maybe
Mhm.
a year. So it's kind of nice. It's kind of nice.
It is.
So speaking of that, share a story for us, Dr. Martinez, a patient story you've had,
Mhm.
a patient that you treated, and what that experience was like.
So I actually had the pleasure of meeting actually at this clinic. He he actually had three strokes. So he had one
Wow.
15 years ago. Well, the first one was a TIA, second one was a massive stroke, and then the third one was maybe, let's say, the last five years ago. And so when he came to Sterling, he was like completely out of hope, and he came with his wife, and he has been very special to treat because, as physical therapists, they probably would have only thought they would have had intervention in the very beginning. But even as long as it's been, I've been able to see him get better through physical therapy. And now he's like, after a stroke, the deficits, for a lot of these patients are permanent, or, and a lot of these patients think that there's no room for improvement. And, he's been with us 8 visits, and he's already had a significant increase in his, range of motion, his ability to carry out movements against gravity on his own, fine motor capabilities in the affected upper extremity, and reduction in pain. So for me, that's just, sometimes when I come to work and let's say I'm tired, or, you know, I have patients that, if I'm back to back with patients like him make me pause and zoom out a little bit from the day to day rush, and really allow for me to be grateful that I'm in this position to be a guide and share my knowledge, to share, to help patients get better.
I love it. It's such a great story. And it's so amazing. I've done quite a few of these interviews now with different physical therapists. And I ask the same question in regards to share a patient story that really, inspires you or moves you. And probably 90% of the time, it's about a patient, a neurological case,
Hmm.
typically a stroke, where that patient has, been able to just progress significantly with physical
Right,
therapy. And I think that's one of the things that a lot of people just don't understand is the importance of physical therapy and how it can truly make a change in your life.
right,
And sometimes we get caught up in this real kind of modern day medicine where just take a pill and
right,
nothing's going to get any better. You just got to just manage your life this way and manage your pain this way, when
right,
there's really a natural, holistic way that we can actually treat pain, improve mobility, improve function. And
right,
so, of course, we're advocates of physical therapy, but I love those stories. So
right.
thank you for sharing. So next question, Dr. Martinez. So let's talk about the Houston community
Hmm.
and what makes the Houston community so special. Especially, you may have some bias because I know you're not necessarily originally from Houston, but what makes the Houston community so special, and why do you like serving the people here in Houston?
Oh my
Or
God, I
Great.
love it. I was even going to add, when you were talking about patients that we encounter, I
Uh-huh.
mean, Houston is such a beautiful, like, big melting pot of a patient population, but also even the diagnosis that we get to treat. I think what's really nice, since I'm from Brownsville, you don't really have there's not a lot of advocates for physical therapy, right? They're usually,
That's
some
right.
back pain, rotator cuff tears, but like a lot of people where I'm from, when they think about physical therapy, they are just thinking that we're going to treat them only if they get hit by another car, right? Like car accidents, or maybe if they have surgery, but even then they're not educated well enough to know that. So in Houston, it's nice because I feel that there's a greater knowledge of physical therapy, and there's a lot of more patients that are actually proactive about their care. And they come to us when they should, in the very beginning stages, versus coming to us 5 years later when they've had back pain and no one's been able to help or intervene. Patients in Houston are very big advocates for their own health. And so I love that, because I feel like I'm able to be more of a guide versus trying to pull teeth to get people to come and exercise. So that's been huge, um, for me as a clinician, because I feel more empowered to keep teaching and helping patients along their journey.
That's such a great point. I'm so glad you brought that up because education is just the key. And we just don't do enough about or with that, with educating the community
Mhm.
on physical therapy and the benefits of physical therapy and how it can make such a significant change. So you're absolutely right. It makes life a little bit easier when there's people that know, what
Right.
we can do, and it's not
Exactly.
such a hard sell. So
Right.
very good, very good. Okay,
Mhm.
so a couple more questions, and I'll let you get out of here. But tell me about just tell me, what do you love to do when you're not working so hard and changing people's lives and all that kind of good stuff? What do you love to do to unwind?
I also love to, as much as I feel, I mean, we're exercising all day as physical therapists, or at least demonstrating. Exercise is definitely my own medicine.
Yes.
Just last night, I took an amazing hot yoga class, which is also a favorite. Cooking and turning off. So a lot of meditation and self-reflection work, reading and traveling. It's like it all has to flow together.
Okay, so all that sounds great except for the hot yoga part. Too hot. I don't
You
know.
need
It's
to
already hot
try
in
it.
Houston. Like, what are you doing? Just go outside. I don't know.
That's what my patient told me today. She said, "You should come over to my house and help me with yard work, and then you'll love, if you really love it that much."
Exactly, exactly.
Yeah,
Well, awesome. Well, thank you so much, Dr. Martinez, for your time. It was a
of
pleasure
course.
getting a chance to learn a little bit more about you. I've learned a little bit more, and hopefully our patients in the community have learned a lot more as well, which
Absolutely.
I'm sure they have. And so for those people that are having an opportunity to watch this podcast, if you are interested in seeing Dr. Martinez, you can find her at our Sugarland Clinic, and we would love for you to experience her expertise. So, thank you, Dr.
Love it.
Martinez. Have a
Thank you
great
so
one.
much. Likewise.